so let's talk more specific about food being medicine. Now, as a pharmacist, I will tell you, I had the opportunity in pharmacy school when they still taught this class. Back in 1991, I took a class called pharmacognosy. And literally, if you look up the root word of it, pharm means drug, and ognosy means knowledge. So, and really what it is, it's a study of plants and the history of plants and used as drugs and where we get those. And when you look at the history of most all pharmaceuticals, and even, within the last, decade or so with some of the biotech drugs, it's a little bit different, but most all pharmaceuticals come from a plant source originally. When you look at statins, for instance, lovastatin. Lovastatin was originally isolated from red yeast rice. Look at antibiotics. Penicillin, came from moldy cheese. And the list goes on. Digoxin comes from foxglove, and aspirin comes from white willow bark. I mean, it just goes on and on. So we shouldn't be surprised that food should have some kind of medicinal property in it if we eat the right things in the right portion. So I guess with that, can you expand on that?
Yes, absolutely. And you're right. When we look at what God has given us, as I said, He's given us the food of the earth to fuel and feed our body. We, over the years, have gone away from what He's given us. And you don't need to read a label when you're eating an apple, right? We need to learn to read labels, though, because the front of the package does not tell the full story. So people always send me packages and say, how is this to eat? And I'm like, what's the back? Let me see the label, particularly the ingredients, because I don't really care how much fat, how much protein, and how much fiber something has in, or how many carbohydrates something has in, if the ingredients aren't real food. I don't want to see it. I don't want to eat it. My body can't identify it, and nor can yours. So in a processed food society, our foods are causing us to be sick. Inflammation, which is linked to cancer, by the way, is wreaking havoc on it. We need to eat an anti-inflammatory diet. Of course, sugar, as I mentioned earlier, it feeds cancer. Just look at the tests that we do for cancer patients. Okay. The sugar goes right to the cancer. That's how we identify where it is, right? And so we know that sugar is inflammatory. We know that white flour is inflammatory. We know that today's wheat is not our grandmother's wheat. It's genetically modified. And so we need to eat an anti-inflammatory diet. What is that? Well, if you like fish, for instance, wild fish is what you should be looking for. Don't eat tilapia. Don't eat any kind of fish or seafood that crawls at the bottom of the ocean or that's farm raised. And I'm talking, yes, even shrimp, okay, crawls at the bottom of the ocean. We need to stay away from those kind of things and look for wild cod, wild scallops, wild fish. And that is anti-inflammatory. Wild salmon, organic salmon, and stay away from anything that is farm raised. We know that a lot of fats can be inflammatory. We want to stay away from hydrogenated oils. We want to stay away from anything that is a trans fat. We want to eat those healthy fats, avocados, nuts. If you're trying to eliminate fat on your body, it makes perfect sense to cut down on the amount of fat you put in your body. And also, of course, portions matter, but look at the type of fat. Cheese is processed. Most cheese is incredibly inflammatory. I would say all cheese. And so when we're looking at what we're eating today that causes inflammation, we want to make sure that we focus on mostly vegetables. If you take your plate, which is round like this, right? And you cut it in half, half of that plate should be your vegetables. and cruciferous vegetables. Cauliflower, broccoli, Brussels sprouts, all of that. And greens, of course, not iceberg lettuce, but collards and kale and spinach. All of that is anti-inflammatory. And it's like a broom that kind of just sweeps our intestines. And knowing that our gut microbiome is the ecocenter of our body, it's where not only our set point weight is determined, but also it's where our immunity is. So, hey, we just had 2 years of COVID, right? What should you do? Make sure that you're not killing off all your good gut microbiome, because that's what we need for our immunity. And I know you know this, Shawn. All of this is not news to you, but to our listeners, what kind of fruit are you having? You should have fruit that bleeds on a white napkin: blackberries, blueberries, raspberries, elderberries. Anything that bleeds on a white napkin is high in antioxidants and helps us fight free radicals and is anti-inflammatory and healing for our body and anti-cancer. I could do a whole show on cancer because I am so passionate about the anti-cancer diet, which is something that all of us should be eating, honestly, because we all are at risk for disease and cancer. And, herbs and spices, there's so much we can do with that. Turmeric, so wonderful for you. High anti-inflammatory, anti-cancer. Of course, curcumin, you know about, Shawn, and it all goes together. So when we look at our diet, when you go into the grocery store, you want to stay in the produce section mostly. So when you look at that plate you have, half of it should be vegetables, the other half, cut your plate in half. 25% be your protein, whether it's plant-based, which I would recommend primarily a plant-based diet, the other quarter of that half. So you're cutting your half of your plate in half, and you cut it in half again. 1/4 should be your protein, and 1/4 should be your healthy carbohydrates. Quinoa, sweet potato. I just had one last night. Brown rice, black rice, and carbohydrates that are nutrient dense and just aren't filled with just carbohydrates with no nutritional value, right? And healthy fats as well. This is all in my book, by the way, The Raw Truth Recharge, 7 Truths to Health and Fitness. And I have a step-by-step detox in there, which is so important for our body. We should detox seasonally because there's toxins in the air, the food, the water, and the soil. And so we have to be careful of cleaning products as well as what we eat. So what we put on the end of our fork can either cause disease or it can prevent disease. I mean, we have to have health by choice, not by chance, not by just the roll of the dice, right? And we know that everything is permissible. Everything is permissible, but not everything is beneficial. And that's biblical.